families know the reality and the challenge of living with members of their family who struggle with the onset of a diagnosis and with the challenges that present themselves. And so that's why we always like to include a family to address us at the legislative breakfast. And we don't want to forget them. And so we're very, very happy to welcome today Michelle and Catherine Papagno and their son Steve, who is with them as well. So Shailene, why don't you tell us a little bit about the Papagno family?
Okay, Catherine and Mike Papagno are parents of a blended family of 5 children ranging in the ages of the teens to young adults. Balancing work and raising a family is a challenge, as many parents in the room would recognize. But Catherine and Mike were faced with a new and unexpected challenge when they learned that one of their sons was urgently in need of mental health services. They are here to share their story about having to confront the unknown and finding the help that they needed for their son.
Okay, great. So Catherine's come on here.
Thank you all so much for hearing our story and for inviting us to be here today. The story begins as this. It was January of last year, and I remember that day very vividly. It was snowing outside, and I was in my home office on a business call when my cell phone lit up with a message. It was from my 14-year-old son's girlfriend. I recognized only 3 words on the long text message: Stephen, cutting, and suicide. I dropped my business phone, ran outside to read the entire text, thinking that the cold air might clear my head. I didn't even know what cutting was, but what I did know was that we were in crisis mode. I immediately called our family doctor, who referred me to the nearest emergency room. I drove to the bus stop. I waited for my son. I read the text again a dozen more times until he finally arrived. We spoke very little on the drive to the ER. He did admit to cutting, but stated he didn't want to talk to me anymore about anything. So that was our entire dialogue about some condition that I knew nothing about. That was the day, 14 months ago, that the world of mental illness entered our lives. We spent endless hours waiting in the emergency room, but it wasn't your typical ER visit. We were under lock and key with security guards outside our room. Eventually, the nurses and the doctors and the case managers and the psychiatrists and the insurance administrators and the social workers, they all came in to interview my son and me. They came and went through the afternoon and into the night, and oftentimes I was asked to leave the room, or I would sit in the waiting room crying. After midnight, I was told an ambulance would soon take my son to an adolescent unit in a psychiatric hospital. My head pounded from the amount of information that was being thrown at me during our 12-hour stay in the emergency room. But worst of all, I learned that my son had been cutting since the grade of 3. And here I was, his mother, and I hadn't a clue. Stephen was diagnosed with depression, anxiety, PTSD, and suicide ideation, terms that I knew nothing about until that day. I Googled cutting and suicide ideation during one of my breaks in the waiting room of the ER, but nothing I read made any sense to me. Why would someone intentionally harm themselves when it appeared that they were so healthy and so active and of sound mind and outgoing and seemingly okay and happy in their life and their day-to-day activities? Well, in the months following, we visited 6 more emergency rooms, 6 more adolescent units, The acronyms of CDAC and ART, along with partial programs and residential settings, were becoming routine terms in our language. It was an emotional roller coaster for our family as we were dumped into this whole new and completely unfamiliar world. Stephen was missing most of his eighth grade school year. I had exhausted all of my vacation days and leave from work, but we continued to enter and re-enter the revolving doors of one hospital after another until last spring. Last spring is when my family was finally introduced to an agency called DMH. The Massachusetts Department of Mental Health entered our lives when my family and I thought there would be no end to the cycle of Stephen's admits and discharges to the various emergency rooms and psychiatric facilities located throughout southeastern Massachusetts. It's DMH that is responsible for having stopped the madness and hysteria we have been experiencing on our own as we ventured from one ER to another, one adolescent unit to another. DMH guided us and they supported us in navigating the waters through a system that I clearly did not understand. They supplied us with tangible knowledge, relentless support that we had yet to receive in half a year's time. They provided not only in-home, but in-community resources to assist my son and our family with coping with mental illness in a proactive versus a reactive manner for all those months. They recognized our despair and gave us the tools necessary to get the help for our son that he so desperately needed and what we had been so unsuccessfully searching for 6 months straight. DMH also supplied our family with a hope that did not previously exist. And that hope came in the form of people. People who were and are experts in this field that was so foreign to us. People who genuinely cared about Stephen and his well-being. People who saw a family struggling with a new challenge, mental illness. They spoke openly and candidly with us about mental illness and how it can affect each member of the family, not just the one afflicted with a disease. They opened channels of communication within the school system, with the many professional providers, within the community, and most importantly, amongst ourselves, Stephen's family. With the assistance of DMH Children's Case Management Team, our son has had the opportunity to work with and share time with a youth support staff out in our community, learning positive behaviors when away from home or school versus self-destructive ones. Our family has worked with their flexible support clinicians assigned to us to ensure that we are supporting Stephen and each other in educated ways. Stephen even attended a therapeutic camp last summer at Wadico in New Hampshire, yet another resource facilitated by DMH where he flourished with peers experiencing similar challenges. DMH has taught us that mental illness, although not physically recognizable like someone with the flu, is indeed just that, an illness. It's an illness that can be diagnosed, an illness that can be treated, and an illness that can and should be talked about just as freely as someone with a broken leg. For us, DMH has taken us out of the closet. We have conversations about our experience with mental illness now that we no longer feel a negative stigma being held over our heads. So where are we today? Well, this is our Stephen. Horseback rider. He's a model. He does martial arts. He plays the guitar. He reads, he bakes, he gardens, and he hangs out with his friends. He also suffers with depression. He recently experienced a setback or a relapse just 2 months ago. Once again, DMH intervened immediately. Their mobile crisis intervention team met us at the emergency room and quickly helped identify the proper treatment plan and facility for Stephen. Although an ongoing struggle for Stephen and our family, Stephen continues to learn and utilize more positive types of coping skills in dealing with his internal challenges. And DMH continues to stand by us as we navigate the channels of mental illness, the causes, the diagnoses, and the treatment. In closing, I simply wish to say thank you to our partners at DMH who have essentially become a part of our family. They have made it abundantly clear that they are by our sides to continue on our course for success. Not necessarily a cure, but a successful outcome for our son and our family that otherwise would not be achieved without them. And I thank you so much.